Welcome back to MedCity FemFwd, a podcast dedicated to discussing the breakthroughs and challenges in the women's health space. I'm Marissa Plesha, reporter for MedCity News. Morgan Health, a business unit of JP Morgan Chase, recently published a report comparing maternal health outcomes between employer-sponsored insurance and Medicaid. In this episode, I sit down with Emily Lindemer of Morgan Health to discuss the findings. Hi, Emily. Thanks for joining MedCity FemFwd.
Hi, Marissa. It's great to be here.
Yeah, so maybe just to start, you could tell me a little bit about yourself and what Morgan Health does.
For sure. So my name is Emily Lindemer. I'm the Executive Director of Data and Healthcare Innovation at Morgan Health. We are an organization within JP Morgan Chase that's really focused on improving healthcare for the roughly half of Americans who receive their healthcare from their employer. We do this through investments, through innovation, through policy and advocacy work. My role there is primarily focused on data, infrastructure, analytics, all of the above. But I also kind of lead a lot of our work in the maternal health space.
Great, thank you. And going off of that, you recently just released a report on maternal health and employer-sponsored insurance, which you co-authored. Before we get into the findings, can you tell me a little bit more about why you decided to release this report?
Yeah, definitely. So I think anybody who's kind of in the know about things going on with healthcare and maternal health in the US knows that there have been big headlines for a while about the state of maternal health in America. There are a lot of problems. And we wanted to kind of understand how are these problems specific to people who get their insurance from their employers? So those on like commercial insurance rather than Medicaid. And that's about half of people who give birth in America. And we wanted to know how big are these problems in the commercial space? Are they different from those on Medicaid so that we could really refine our approach to how we want to make a dent in maternal health?
Yeah, thank you for sharing. And, what findings really stuck out to you? And also, how did you go about conducting this report?
Yeah, so we looked at publicly available data. There's some really great data out there. You can get data on every birth record that happens in the U.S. Things like basic demographics of the mother and the baby, method of birth, complications during birth, et cetera. So we use publicly available data through the CDC. We also use some publicly available primary interview data from the National Health Information Survey. And to kind of get some, firsthand responses to people's experiences in like that year after they give birth. That was the data that we used. And we focused our findings on a few key areas that Morgan Health is particularly interested in. So we're really interested in access, affordability, and quality. So we wanted to look at those aspects of maternal health in the data as well. And so our primary findings were one, around the affordability of childbirth. And I can go into detail on that in a minute. Quality, which we looked at through the lens of C-sections that occur in low risk pregnancies. And a little bit about mental health as well from that national interview.
Yeah, and you mentioned that you could go into a bit more detail on those three areas. Do you mind sharing a bit more on that?
Yeah. So, one of the things that has really stuck out to me about maternal health since I started really looking into this space is just how expensive it is to have a baby in the US from the point of view of the person who gives birth when you are not on Medicaid. So, for those who don't know, if you qualify for Medicaid when you are pregnant, more often than not, Medicaid will cover pretty much all of your out of pocket expenses, all of your prenatal care, the birth itself, and postpartum. If you are on commercial insurance, that is not necessarily true. And Kaiser Family Foundation has put out some stats on this as well. But the estimated out of pocket cost for a person giving birth on commercial insurance is $3,000. And that is not money that a lot of people have to spend just on the act of giving birth. And was really important to us because another thing that we've been uncovering through all of our work is that there are a lot of additional services that surround pregnancy that cost additional out-of-pocket money. They are not covered by insurance. So the primary one that we think about a lot are doulas. Doulas are people who help support the birth. They're not clinicians, but they give a lot of really meaningful emotional support during the pregnancy and the birth process. And they've been shown to have really good impact on overall outcomes. Medicaid is like leading the charge in covering those. So many states have full coverage of doulas in addition to that total coverage of the childbirth experience. Whereas in commercial, $3,000 for out of pocket just for the birth, a doula costs like $2,000. So you add that up and you start to realize that this is unaffordable for so many people on employer sponsored insurance. And so we kind of wanted to put some more real statistics behind that affordability. And we looked at the data to see how many people qualified for WIC, Women, Infants, and Children, which is federal assistance for pregnant people or people who recently gave birth, primarily for food and other, basic necessities. And we found that 13% of people on employer-sponsored insurance are receiving WIC. So they're financially in the zone where they can still get that assistance. And when you look at certain racial subpopulations, predominantly Black birthing individuals, 26% of those on employer sponsored insurance receive WIC. So if you kind of take that all together, you start to be able to piece together in your mind just how unaffordable childbirth is. And then on top of it, all of these other things that you might want, like a doula.
Yeah, some very interesting findings there. Going off of that, was there anything that really surprised you off of this report?
So I think the WIC findings were really surprising to me. I was shocked to see just how many people were in a low enough income tier that they would still qualify for WIC, and kind of what that means for these costs of maternal care. But you would hope that at least if people are paying all of this money, that maybe their outcomes are it's coming out in the outcomes somehow. One of the really surprising things was that in fact is not coming out in the outcomes, and in fact women birthing individuals who are on commercial insurance actually have higher rates of C-sections for low risk pregnancies. So you can read in the report how we define a low risk pregnancy, but if you have a low risk pregnancy, chances are that a C-section is not, a necessary intervention for you. And we found that over 14% of women with commercial insurance were having C-sections for low risk pregnancies. That number was lower in Medicaid. So you're paying more and you have worse quality outcomes. That I think is really surprising and really a call to action.
Yeah, absolutely. Very well said. I'm also just curious, did you look into whether research on this topic has been done in the past? Is this the first time that you've seen a report like this done?
So we've definitely seen research done on just the sheer cost of childbirth. The Healthcare Cost Institute, Kaiser Family Foundation, they've put out a lot of work on this. We have not seen somebody really specifically look at commercial versus Medicaid and put both quality outcomes like C-section rates and cost side by side. So we really felt like this was a really kind of novel way to look at all the data and do these comparisons. And the important thing about those comparisons is that we really do see Medicaid leading the charge in maternal health. Like I said, we see them offering full coverage for these services. We see state by state greater adoption of doula services. We see them expanding their postpartum coverage from 6 weeks to a full year. So, because of that, all of this innovation that's happening in the Medicaid space, I think we are really trying to push this out there as a call to action for the commercial side, employers, carriers alike, to bring more innovation to the commercial space because it is definitely needed.
Yeah, absolutely. Well said. Well, one last question for you. Based on the findings of this report, what recommendations do you really have for employers?
Yeah, I mean, I think one of the big things is figuring out ways to reduce out of pocket spend, figuring out ways to kind of make that childbirth event more affordable, but also all of the things around it. If you can offer something as a benefit, I think that would go a long way. We think providing data about the quality of care to employees, often, your chances of getting a C-section are highly dependent on the hospital you go to or the provider you see. So trying to offer more transparent data so that people can make more informed decisions, I think is another thing employers could do. One other finding from the report that I didn't mention was we did look and see how prevalent the self reporting of anxiety and depression was in that year after postpartum. And for both Medicaid and commercially insured women, it was about a third of people responding that, which tracks with other things in the literature. And we think that that postpartum period is also a time when employers can really make a big difference, figuring out how to better support new moms, offer maybe mental health benefits specific to postpartum care. So I think those three areas of really affordability, quality, and mental health. And then I alluded to this as well. The disparities between racial subpopulations are there, they are real. And I think really thinking if you have limited resources and can only offer certain things to smaller groups, really think about who needs it the most.
Yeah, some really great recommendations. Thank you so much for sharing. Emily, really appreciate you joining the MedCity FemFwd podcast.
Thank you. It was so nice. Thank you.